Welcome to Genius Healthcare Solution, and today we will discuss some of the ICD topic which are burn, myocardial infarction, respiratory system diseases, psychiatric disorder, pain management, and external factor. So we will start our today session with burn coding. So there are three categories of burn: first degree burn, second degree burn, and third degree burn. In case of first degree burn, it's just erythema. So if a person get first degree burn, the area will be red in the nature. But in second degree burn, there will be blister formation. And in the third degree burn, there will be a loss of skin. So if patient get multiple degree burn at the same body part, in that case, we can only use highest degree burn ICD code. But if body part is different and degree is different, so in that case, we need to provide all coding for all body part along with their respective degrees. So if a patient, if I understand with the example, if a patient has both third degree and second degree burn on the right upper arm, in that case only third degree burn of the right upper arm will be coded. And when we code burn, there will be a lot, many times you will identify the word trunk. So trunk in coding, medical coding represent chest, abdomen, upper back and lower back. So whenever is trunk is mentioned in whether it's ICD or CPT, it's represent the chest, abdomen, upper back and lower back. If we search some example for the burn coding, then we have like a second degree burn of right index finger, initial encounter. So by default, we will consider initial encounter until subsequent or sequelae is not mentioned. So there are two methods we can search. We can go into the alphabetic index burn, then we will search finger over there. Then under the finger, we need to search the index finger. And then we will found a CPT code T23.22. And whether it's a right or left, this information we will get from the tabular index. And there is also a initial, subsequent and sequelae digit is mentioned. So A is for initial, D for subsequent and S for sequelae. So in this particular example, second degree of the burn of the right index finger, initial encounter, the code will be T23.221A. Or we can directly go into the ICD code because burn codes are from T20 to T31. So if you have multiple burn, you can directly go into the T20 series category and check your body part, and according your body part, you can use ICD code. So burns code are 7-digit codes and first 3 digits are denote body area. So first 3 digits are denoted body area. Then fourth digit denote degree of burn. So in this case, if you see, it's a second degree burn of right index finger and the fourth digit is 2. So second degree represent number 2. So the fourth digit will be 2. If we make changes and make it a third degree burn of right index finger, then the fourth digit will change to 3. Fifth digit represent the body part. So it's the index finger. So index finger represent the 2, number 2. Sixth digit represent left or right. So if left right mention, then our sixth digit will be according to that. Normally 90% you will found left represent 2 and 1 represent right. So here it's a right index finger, that's why the sixth digit is 1. And it's an initial encounter, that's why the 7th digit will be A. So 4th digit represent degree, 5th digit body part, 6th digit laterality and 7th digit initial, subsequent or sequelae. So whenever you will found that there is no left or right mention, In that case, your 6th digit will be X. So if you see, you can check the 4th example, 3rd degree burn of the face, initial encounter. So it's a 3rd degree, that's why our 4th digit is 3. So it's a T20.3, and for face it's a 0. Then we do not have left, right, then X, and then A. Similarly, chest, again there is no information of chest because chest is one area. So there is no left, right. So 2nd degree burn of the chest, initial encounter, T21 denote the thoracic cavity, upper trunk. Then we have 2nd degree burn 2. Then we have chest area 1. There is no left, right, then X, then A. So by doing this, we can easily identify whether our codes are correct or not. So either you can go directly into the ICD codes, or you can go in the alphabetic index burn. Then you need to search your area and body part, and then you need to check that which degree mentioned in your medical record. Again, you need to provide the code for initial, subsequent, or sequelae. Then we have rule of 9. So rule of 9 will only implement when you have 3rd degree burn in your medical record. Because rule of 9, it says whenever you have the 3rd degree burn, you need to provide an additional code T31.XY, where X represent TBSA, total body surface area, and Y represent 3rd degree burn. So if patient get burn at multiple body part, then we need to calculate the total body surface area, and out of that total surface area, we need to check how much percent the 3rd degree burn is there. So to calculate the total body surface area, we have a 9 rule. So rule of 9, or you can say, so your head and neck comprise 9%, chest is 9%, abdomen is 9%, upper back 9%, lower back 9%, right arm 9%, left arm 9%, anterior leg 9%, posterior leg 9% for the both left and right, and genital organ 1%. So if we add all this information, then we get 100%. So our body is 100%. Now, how to use T31.XY? So X is TBSA. So we always need to calculate the TBSA into 2 digits. So suppose if TBSA is 63. So what we will do, we will take 6 from 63. Okay. And 3rd degree burn is 9. So first we make 9 of 3rd degree burn into 09, 2 digit. So our first digit TBSA is 63 and 3rd degree burn is 09. Okay, 9%. So we will take 6 from 63 and 0 from 09. So the code will be T31.60. Now, if it is like 36 is 3rd degree burn and 18 is 36 is the 3rd degree burn and 63 is TBSA. So in that case, my code will be T31.63 because I will take 6 from 63 and 3 from 36. If TBSA is 36 and 3rd degree burn is 18%. So my code will be T31.31, 3 from 36 and 1 from 18. So by doing this, we can easily get this code T31.XY. Then we are going to discuss one example, and so there is a patient who's have 2nd degree burn of the right index finger, 1st degree burn of the right forearm, 3rd degree burn of the left wrist, 3rd degree burn of the lower back, 2nd degree burn of the chest, 3rd degree burn of the upper back, and 2nd degree burn of the right thigh. So what we need to do? First of all, we need to provide ICD code for all these burn. So there are different ICD codes mentioned. For 2nd degree burn of the right index finger, it's a T23.221A. 1st degree burn of the right forearm is a T22.11A. Then 3rd degree burn of the left wrist, T23.372A. 3rd degree burn of the lower back, T21.34XA. 2nd degree burn of the chest, T21.21XA. third degree one of the upper back T21.33 XA, and second degree one of the right thigh T24.211A. So once we done with the all codes, then we need to ask question from ourselves. Is there any third degree burn mentioned in the medical record? If answer is no, our coding will be completed. But if answer is yes, then first we need to count the TBSA. Okay, so in this case, so first two area, right index finger and right forearm, they comprise 9% because our left arm or right arm is 9%. So whether it's an index finger, hand, thumb, forearm, elbow, whatever is mentioned, it cannot be exceed 9%. So because it's a right index finger and right forearm, so both will give us 9%. Then we have third degree burn of the left wrist, again 9%, the total will be 18. Third degree burn of the lower back, 9%, 27. Second degree burn of the chest, 9%, 36. Third degree burn of the upper back, 9%, 45. And second degree burn of the right thigh. So it's not mentioned anterior or posterior, so we will count is whole. So it's a 18%. So our TBSA will be in this particular example 63%. Okay. Now what we need to do, we need to count the third degree burn. So we have a third degree burn of left wrist, lower back and upper back. So 9%, 9%, 9%. So it will be 27%. So my code will be for this example will be T31.62. I take 6 from 63 and 2 from 27. So this is the easiest way that we can provide additional code T31. And you also remember that if TBSA and TBSA is less than 10%, in that case we will use T31.0. Okay. So if TBSA is less than 10%, we need to use T31.0. So this is all about the burn. The more practice you do, the more confidence you will get. Our next topic is myocardial infarction. So myocardial infarction, we need to remember some guidelines. Then we can easily provide the ICD code for that. So for acute myocardial infarction, okay, for acute myocardial infarction, time frame is 0 to 4 weeks. So if patient get myocardial infarction and came to the hospital or physician office within 4 weeks time, then we can take acute myocardial infarction code. And normally the ICD codes for this started with I-21. Second is subsequent MI. So already patient got one myocardial infarction, and within the 4 weeks of this myocardial infarction, he get MI of another body part or another part of the heart. So suppose earlier he got myocardial infarction of the anterior ball, now he had myocardial infarction of the posterior ball, but he get this infarction within the 4 weeks time duration. So in that case, the second MI he get, we will use I-22 series codes. Okay. So I-22 represent the subsequent myocardial infarction. And for the initial myocardial infarction, we will use I-21 code. If treatment is going but duration is more than 4 weeks, then we need to use old myocardial infarction code, which is I-25.2. Or old myocardial infarction is already healed and there is no current treatment is going on, still we need to provide the I-25.2 code for old myocardial infarction. So there are some MI codes we have available for, as I told you, there are multiple parts in the heart. So we have I-21.0 for STMI of anterior wall. Then we have I-21.1 STMI of inferior wall. Then we have STMI of other side I-21.2. And we have one code for non-STMI also. So these are not the site specific I-21.3. Now we have some scenario for myocardial infarction. So suppose if patient admitted to the hospital for NSTMI. Okay. So when he admitted to the hospital, he had NSTMI, means non-ST elevated myocardial infarction. So what is non-ST elevated? So in ECG, if you see the ECG chart, then there is a PQRST complex. Okay. So in this PQRST complex, the S and T segment get elevated. Then we will say it's a ST elevated. Okay. And if patient have infarction, but ST area is not elevated, in that case we will consider it non-ST elevated myocardial infarction. So if patient admitted to the hospital with non-ST elevated myocardial infarction, but later is converted into ST elevated myocardial infarction, in that case we cannot use non-ST elevated myocardial infarction code. We need to use ST elevated myocardial infarction code. So NSTEMI to STEMI is always consider STEMI. And by default, if STEMI or non-STEMI not mentioned, then by default we will take STEMI code. Now, the third scenario, if STEMI converted into NSTEMI. So earlier it's ST elevated myocardial infarction and later it converted into non-ST elevated myocardial infarction. In that case, we will provide code for ST elevated myocardial infarction. So we can easily check that whether it's a STEMI or NSTEMI. Once patient medical record documented STEMI, we always provide code for STEMI. Even though the NSTEMI or STEMI not mentioned, still we need to provide code for STEMI. And we also need to aware about the time frame for 4 weeks, and if duration is more than 4 weeks, then we have I-25.2 code which is for old infarction. And again, one more thing you need to remember, if patient get one infarction and second infarction he get within the 4 weeks, then we need to provide a subsequent infarction code for the second infarction. But first code we will use for the acute condition. So if I can say check the one example, myocardial infarction in 2018, percutaneous transluminal coronary angioplasty performed in 2019, and coronary artery bypass performed in 2018. So what happened? Patient get MI in 2018 and patient underwent the bypass graft. And maybe a later, after couple of 1 year, his some graft has been closed. For that, physician performed the angioplasty. So we need to provide 3 ICD code for this scenario: I-25.2, Z95.5 and Z95.1. Then we have myocardial infarction of lateral wall 2 weeks ago. In that case, we need to provide acute myocardial infarction of lateral wall MI, which is I-21.29. There are some risk factors which increase the MI. It can be a tobacco or personal history of nicotine dependence. Use of alcohol is also some sort of put the impact, but normally alcohol gives damage to the liver part. So we need to remember these guidelines, and we can easily code the myocardial infarction coding. Next topic is CVA. So CVA stands for cerebrovascular accident. It's also known as stroke. To search the CVA code, either we will go into the CVA or we need to go into the stroke. So stroke again consider the hospital inpatient diagnosis. So most of the time this stroke code need to be used in the inpatient only. So if patient have stroke, we need to provide the ICD code I-63.9. But maximum time we will get late effect of stroke. So it can be immediately, it can be after 1 month or 1 year or maybe 2 years. So there is no time effect of late effect, and late effect also known as residual effect. To search the late effect code, we need to go into late effect, and under the late effect we need to check cerebrovascular disease, and under the cerebrovascular disease we will found whether it's a hemiplegia, it's a hemiparesis, or dysphagia, aphasia. So whatever late effect is mentioned over there in medical record, we need to provide code according to that. There may be a more than one late effect, so we need to provide code for all late effect. If there is a history of CVA mentioned, then we need to provide code for history of CVA, which is Z86.73. So Z86.73 code we can only use if patient do not have late effect of CVA or current CVA. Because if patient have current CVA or late effect of CVA, in that case we can only use those code. So history of CVA code can be used if there is no CVA or late effect of CVA, and the code for that Z86.73. Then we have next topic, pressure ulcer. So pressure ulcer also known as decubitus ulcer. So to code the pressure ulcer, we need to consider two things. One is site of the pressure ulcer and the second is stage of the pressure ulcer. If stage of the pressure ulcer is not mentioned, we can take unspecified pressure ulcer code. Then if there are multiple stages mentioned for same site, then we need to provide highest stage code. And if there are multiple site and multiple stages, in that case we need to provide code for all stage and all sites. So here we can see one example. Patient had right ankle stage 2 and right ankle stage 3. In that case, we need to provide ICD code for right ankle stage 3 pressure ulcer code. And if we have right ankle stage 2 and left ankle stage 3, in that case we can provide code for both right ankle stage 2 and left ankle stage 3. So these are the pressure ulcer. Our next topic is respiratory system disorders. So we do not have any specific guideline for respiratory system disorders, but you need to remember that there are combination code available for a couple of diagnoses. So you need to provide combination code like COPD asthma, COPD bronchitis, COPD or asthma with bronchitis. Or you need to remember that if there is acute exacerbation, you need to provide code for acute exacerbation. So there are some common condition like pneumonia, COPD, asthma. So as soon you search these codes in your ICD-10 CM book, or there may be a respiratory failure, a chronic respiratory failure, acute respiratory failure, emphysema, emphysema, so pleural effusion. There are so many respiratory disorder, or like aspiration pneumonia is also there. Hospital acquired pneumonia or viral pneumonia, bacterial pneumonia, multiple type of pneumonia are there. Then we have pulmonary fibrosis or interstitial lung disease. So these are the common respiratory system disorder which used in medical records, and it's only used when a patient has these conditions. So we do not have any such guidelines for respiratory system disorders, but we need to able to search all these kind of disease into the alphabetic index and need to confirm these into the tabular index. Then we have next topic is psychoactive substances use, abuse and dependence. So there are three categories: use, then we have abuse, and then we have dependence. Use, if somebody is using smoking or alcohol, so this is use. If they exceed the numbers, he smoke 5 packs or 6 packs a day, then this will be abuse. Then dependence, patient cannot survive without these substances, maybe illicit drug, or maybe smoking, or maybe alcohol use. So what we need to do? If physician mention all three conditions, we only provide code for dependence. If physician use and abuse, then we only need to provide code for abuse. And use we can only use if there is no abuse or dependence mentioned in medical record. So the sequence we need to remember: if use, abuse and dependence is there, we only need to provide code for dependence. If use and abuse is there, then we need to provide code for abuse. So some common psychoactive substances are alcohol. Then we have code for use, abuse and dependence. Then we have cocaine, opioids, sedatives. Then we have nicotine. Z72.0 is used, and dependence is F17.2 for that. Then we have pain management guidelines. So pain management guidelines also important. So if patient came for the hospital for pain management, in that case, pain ICD code will be the principal diagnosis. So normally for these kind of pain management, we provide G89 codes for pain, and along with that, we need to provide site-specific pain. So G89 normally used for chronic or acute pain. So if patient came to the hospital with pain for pain management, then we need to provide G89 code and site-specific code. So acute or chronic code we need to provide, acute pain or chronic pain, and then we need to provide site-specific pain. Then we have post-operative pain coding. So if patient have post-operative pain, then we need to provide principal diagnosis as post-operative pain. And we have chronic post-operative pain and acute post-operative pain, G89.18 and G89.28. Then we have neoplasm related pain, which is G89.3. So whenever patient have a neoplasm, he may get a severe pain, and for that we need to provide G89.3 as the principal diagnosis and neoplasm code as the secondary diagnosis. But if patient came for excision of this neoplasm, in that case neoplasm will be the principal diagnosis and G89.3 as the secondary diagnosis. So if reason for the admission is pain management, then pain code will be the primary, and if reason for the admission is excision of the cancer, in that case cancer will be the principal diagnosis. And the last topic of ICD, we have external factors. So external factors, as we already discussed, there is a separate index available for external factor, and these codes are VWXY. In physician coding, these codes are not used in that much frequency, but if you are coding for a hospital inpatient or the emergency department, then there may be chances that these codes are used frequently. So there are a couple of type of external factor for which we need to provide code. We need to provide code for cause, intent, activity, and external circumstances. So these are these kind of things which we need to keep in mind when we provide code for external factor. So cause of injury may be like fall, motor vehicle accident. Intent, what is the intent? It may be accidental, it may be self-harm, it may be assault, or it may be undetermined also, because we are not aware about that in that particular case. Place of occurrence, it's a home, street, school, workplace, playground, kitchen, anywhere. Activity when injured, so what patient is doing? Sports, walking, working, and work status, military service, voluntary or paid employment. So there are 5 things which we need to check. It's not necessary that all 5 things will be there. Maybe 2 things will be there, maybe 3 things will be there, but we have cause, intent, place of occurrence, activity, and work status. So if we can do things as per the guideline, we are able to search the code into the external factor index. Then the last point which I need to tell you that it's not related to the external factor. There are neonatal or newborn we will consider if the patient age is up to 28 days. Infant we will consider 29 days to 1 year, and child it's a 1 year to 16 years, and adult 16 years and older. So this is all about ICD Tensium. We discuss today. We have discussed burn, MI, CVA, pressure ulcer, pain management, psychoactive disorders, respiratory system disorders, and we also have other topics which we have different videos, and you can find these videos either on our YouTube channel or on our application, or if you are still not able to find, you can write on info@genushealthcaresolution.com, or you can connect on WhatsApp 9911499911593677. I am repeating again, 9911593677.